Throughout the press conferences that we've held since the beginning press conference, we have committed to you that we would tell you what we know when we know it. And today we continue that. This morning, I had a call with the Cleveland Clinic. Folks at the Cleveland Clinic, Dr. Acton and I did, and they gave us the new information that they have in regard to their modeling and their projections. Throughout, and I'll give you that basis of that modeling or what their result was in a moment. But throughout this crisis, we have said that there really are two different variables that we're trying to impact. One is the distancing that Dr. Acton and I and the Lieutenant Governor talk about so much. I'm sure people are kind of sick of thinking about it, talking about it, and us talking about it. But that's something that each one of us can control. And we've issued orders and we've done things, but ultimately each one of us can control that. And so by more distancing, by people staying at home, by not being in clusters, we slow the spread of this virus. We know it's spreading, we know it's here, we see it in the data, but there's also a lot of spread that we're not seeing, but we know is there. So slowing that process down buys our hospitals and our health infrastructure more time to get to where we need to be. So again, two variables. One is what we're doing, and the other is how we're trying to build up our medical system, particularly our hospitals, to make sure that we're ready when the surge comes. A couple points from the highlights of what we were told this morning by the Cleveland Clinic and their modeling. First of all, within about 2 weeks, and we're continuing to see it go up, but within about 2 weeks, it's going to kick in much harder. And we're really going to start getting hit very hard in our hospitals, in our hospital admissions. They project that we may not hit the peak until now mid-May. Again, modeling is a science, it's an art, but this is the best information, the newest information that I wanted to share with you. In addition to that, they are telling us that we need now to look to a 2 and possibly 3 times build out of what we have today in our hospital beds, in our ICU beds. We'll look at the chart up here. And this is a chart that Dr. Acton has been showing you. Again, this is the projected peak. And so at that projected peak, if we're looking at, we need to go up 3 times in our capacity, that means our capacity is somewhere in this area here. So they're telling us now 2 to 3 times, and we really ought to plan for 3 times. So as you can see, we have a long way to go. And that's the stark reality. The good news, our hospitals have all been thinking about this, planning for this, and beginning to move forward. But in that regard, we are now really closing up the planning, now moving to the action. And some of them have already taken a lot of action, but now we're really going to have to accelerate this very quickly. We've been on the phone today with a number of the hospitals. We're going to have another call later to kind of bring them up to date in regard to this. I have asked, we've divided the state into 8 regions, and I've asked each region to have their collective plan on my desk by tomorrow morning at 8 o'clock as far as a rough draft. Rough draft by 9 o'clock tomorrow morning. I've asked them to have the final draft, and I say final, it's always a work in progress. There will always be some changes. We understand that. But a completed draft to us by 12 noon on Monday. I have asked General Harris of the Ohio National Guard to oversee this buildup. And again, many of the hospitals have plans down the pathway in regard to the implementation of these plans. But General Harris is not in his capacity really as head of the Guard, but in a new capacity, so that he will be, and we will hear from him tomorrow. I've asked him to appear on the screen from our emergency center and talk a little bit about what he is doing and how he sees this. So I wanted today just to bring everybody up to date on, again, trying to share with you the information we have as we have it. We are moving forward. I don't want anyone to be alarmed, but I also want everyone to understand what we face. Again, two things we have to do. We got to do them simultaneously. One is the social distancing. One is to slow this thing down. The other is to build up, and build up very, very, very quickly. We do not have a lot of time. As I said, the projection is we start really getting slammed in 2 weeks, but may not even hit the peak until mid-May. So our goal, what we want for every Ohioan, is that they be able to be cared for, no matter where they are, what county they live in, rural, urban, suburban, that there be a pathway for them if in fact they get sick. As Dr. Acton has said, most of us, we hope, who get this will stay at home, be able to be cared for. 20% or so of us will not be, and a certain percentage of those will end up in the ICU. The hospital stays are a lot longer than we're used to, and so that's another thing that's going to put immense pressure on our hospitals. So again, there are plans. We will share those plans in broad terms as we move forward. We certainly cannot do that today, but each region is working and has been working for this moment. And for this moment is we now move into really high gear. We put the accelerator down. We go as fast as we can. We're now into the building mode. We're now into execution and getting it done. We will also talk tomorrow about what some of the needs are in some of the other equipment, and we'll have the opportunity tomorrow to talk about that.